Please do not begin your test or drink your testing solution until after watching the full video. Ensure that you have read and followed the pre-procedure preparation and you are fasting for your test. Prepare your testing solution by mixing it well in approximately 200 milliliters of water. If you are performing a lactose, fructose, glucose, sucrose or sorbitol test, you will need to mix this sugar substrate in 100 ml of hot water to dissolve. You will then need to add 100 ml of cold water to bring total volume to 200 ml. Allow the solution to cool to room temperature. Perform your baseline sample. It is very important that you perform your baseline sample before drinking your testing substrate. How to perform a breath sample will be demonstrated at the end of this video. Once your baseline sample has been collected, drink your test solution. Do not take any longer than 2 to 3 minutes to consume the full amount. Set a stopwatch to 30 minutes. Once 30 minutes has elapsed, collect your next sample in the collection bag marked 30 minutes. Repeat this process for the rest of your sample collection bags. Refer to your instruction booklet or see on screen now for sample collection times. How to collect your breath sample. Put the white clamp on your baseline sample bag. The white clamp should be open at this time. Place a mouthpiece onto the other end. You will be provided with 2 mouthpieces in the kit, one of which is a spare. Take a breath in and hold your breath for 10 seconds. If you are unable to hold your breath for 10 seconds, reduce this duration to your own ability. After 10 seconds, make a seal with your lips around the mouthpiece. Please ensure that this seal is not broken until the sample collection process has been completed. Begin to exhale gently through the bag at a steady rate, allowing the air to flow out of the bag at the other end. Continue to exhale until you have approximately 50% of air capacity left in your lungs. Once you have reached this point, close the white clamp firmly on the bag. Fully fill the bag with the rest of your breath. Ensure the sample bags are fully filled with your breath sample. Pinch the white tube connected to the mouthpiece and remove the mouthpiece. Immediately place a blue plastic plug on this end. Do not release the pinch until the plastic plug is fully inserted. Place another blue plastic plug on the end of the tube where the white clamp is located. Remove the white clamp. Ensure that the blue plastic plugs are fully inserted. Place the white clamp and mouthpiece on the next sample bag so that it's ready for your next sample collection. Return your completed test kit and consultation form in the pre-addressed mailer. If you have any questions in relation to performing your test, please contact us and we can guide you through the procedure.